he will pay. He'll increase funding to expand community-based preventive interventions to help Americans make better choices to improve their health. Yes.
More grants for marijuana.
All right. Okay, Obama.
So how do we feel about saying we want them to add that everyone insured is part of the plan? Are we now in consensus on that?
Sure.
Everyone should be
Everyone
required
has a-
or, to have some kind of.
I think the thing required is politically unfeasible. So if you say is mandatory, no, is by default you are covered. The government gives you a by default coverage, and then you can buy on top of that, like the Swiss do, And if your copay was gonna be 330 Swiss francs if you are on the bottom of the totem pole, and 2,500 if you are on top of it, which means you get your personal ward maybe, but.
So that,
Well, essentially,
You get the
that's what we
same
have
care.
now,
You get the same care.
Isn't it? I mean,
So-
if you're not insured now
Yeah.
and you go in and nobody takes care of it, the health provider eats some of that cost, but basically often the government winds up picking up the cost for it. So,
right, but you're not enrolled in a health plan.
correct. Now, the one state that has mandatory health coverage is Massachusetts, and yet they fine you then if you. But I don't. That,
I don't agree.
I don't understand how that works
That's-
because if you can't pay your bill.
California tried it. I have one copy here. Schwarzenegger vetoed it. It's called SR 840.
Pay your money.
Yeah.
You either buy the insurance or you pay a special tax and you get the insurance. I mean, it really is a mandate. It is mandatory. What Obama's plan says does not meet that condition. He says we're going to expand programs for the very poor. We're going to create all these programs for people to voluntarily buy into, either
Yeah,
as an insurer
that's a
or
problem.
as an individual. It doesn't quite cover the gap.
Yeah.
Well, but increasingly the gap is in the middle class. The gap is there for the middle class. Increasingly, that's going to be the next vulnerable
It'll
population.
be there for everybody. The rich,
But-
of course, don't have to participate.
But I think that
Students may decide not to participate.
Yeah.
What the Reamer says, I should tell you that while Obama's plan has many of these features, it won't work well because it doesn't insist that all adults have health insurance. As a result, despite the incentives to join, millions of adults will continue to opt out, and hundreds of thousands of small employers won't cover their workers, and thousands of larger employers like Walmart won't cover all their workers.
Exactly.
Obama's proposal to expand Medicaid and SHIP are good. Requiring that all children be covered is good, but unless all adults are in the system too, it won't work well. The voluntary purchasing pool he proposes will face adverse selection. The currently sick will disproportionately join. The currently healthy but future sick will disproportionately opt out, which means its costs will spiral upward because the HMOs involved don't know what risk they're facing. And as I said, millions of individuals and firms will simply not participate.
And the only reason people say that insuring all children is good policy, most children don't get sick. So the reason people say insuring all children is good policy is because it's cheap. The people for whom we have trouble controlling costs are not children.
Also because we don't tend to blame children when they get sick for their own illness, and we clearly do that for adults. What?
Does he agree that children don't get sick?
Most
Children get sick, but we blame them for it. We
Most of them
hold
don't get
responsible for it.
But
And I think the only time we blame someone is when a child has a terribly adverse result because parents did not bring the child to a physician. I mean, then that falls into the area of child abuse.
But we do tend to blame adults
Yes, we
for
do.
getting sick. We've had that discussion in this room today. And it's a huge difference between the Canadian attitude towards illness and the American attitude towards illness, because they don't. They just don't. They say people get sick, people do stupid things. It happens. Some people smoke, some people drink, some people go skiing and break their leg.
From both a
take care of
health
them.
perspective and an economic perspective, it really makes no sense to say, and we will insure all children. This is just what politicians say, because it's relatively cheap, and you can cover another hunk of the population. And maybe later someone will do the hard work of covering, 54-year-olds who are laid off from work and have a variety of early incipient chronic illnesses, and are going to cost a lot of money under the current system.
Anyway, to get back to the issue of how to phrase, coverage for everyone without using something that means mandatory. And that isn't necessarily,
It's
how's it gonna work?
universal.
Yeah, universal base plan for everybody. That's
Word mandatory.
Can we word it as to make affordable health care available to each and every person?
that's how
No, 'cause
Obama
that's
is wording.
basic.
Yes,
Obama says he's done that.
it's available, but if you want, you can opt out, and that's a problem. And in Japan, they solve this. Here's how they solve. In Japan, they have social insurance and they have national insurance. And national insurance is for students, for people who are not gonna go kids. Social insurance are for people who have jobs and are employed, and older people who are gonna use the system. But they're both covered, and there is a base level of services that everybody by default, if you are a resident of Japan, even if you're a foreigner, for more than 3 months, this is for Switzerland too, if you're more for 3 months, you have to enroll in the system. It's the law, it's mandatory.
So why don't we
You have
use
to
the
pay?
term and create a universal
You pay a premium?
expectation
I'm sorry?
Okay,
of
I
health
have a
insurance?
question. How do we implement this? How is it going to happen? Traditionally, the federal
What was that?
mandates come down to the state, and then the
In Switzerland,
state has unfunded mandates that go to the locals.
It gets
And,
out of your
you know,
paycheck,
Ozaukee
just like
County
Social
is the
Security.
second richest county in the country. Okay, states
Very
vary in
minuscule
how
to
they
their
view
paychecks, very
what
minuscule.
public services should be made available. So, education or health care is very different in some of the southern states than it is up here in the Midwest. So now, how are you gonna make this mandated or universal? How are you gonna make that work so that it really carries out the intent of this policy, this
Well,
plan?
it's usually a pay or play. In
Right.
other words, what you say is, if you can't, if you don't put your insurance plan on your taxes, then guess what? Your taxes go up by $1,300, and you're put in the government plan. So that would be the mechanism that you use
Well,
for.
how do you do that for poor people who
Well,
barely pay
because
taxes?
because you're doing it on the tax form, it will be scaled by their income.
Okay.
But still, one way or another. And once, of course, you get low enough, you're in Medicaid,
All right, so for the purpose of this meeting, we don't need to find the mechanisms of how universal health care is going to happen. We just need to agree on whether or not universal health care is what would make sense for our nation, and we want to do it. Then we will get down to how it happens in other meetings. I'm just trying to get us to move forward.
And that's fine, except that we have to realize that that's a goal and not reality.
Right.
That's right, a lot of it is reading, but gotta start someplace. That's good.
But we're sending a signal saying we see problems if we don't go universal.
Right.
And that might be the most we can do.
Especially for this evening, so we can have in Susan's house all night.
Alright, so what's next? What's the next?
Well, would anyone disagree, I have to leave soon.
Yeah.
So what I'm gonna say is, would anyone disagree if we simply submitted the rest of the list saying, the rest of these we believe are largely elaborations on the commitments made in the Obama platform. And we think that they should be looked at. Some may not rise to the level of a national platform type statement. But as people are writing the national platform, we would like them to look at these, because they really break down into only about 4 or 5 groups. Workforce, the focus on prevention and the focus of prevention, aligning incentives,
Standards?
Information,
standards and information. Obama, of course, is calling for, was it 300 billion compared to last year's 50 million? So that ought to go pretty far. And,
Stop the war and you
I
gotta
was
pay
just
for
gonna say,
it.
in a month, you pay for something.
I don't know that I saw anything in here on strengthening healthcare provider education, primary care and.
I did find something about that in the,
Yeah, I
It
did
was
see
very
that.
vague compared to what we were suggesting.
By healthcare provider, you mean the doctors?
well, in the public health section, there's a thing about workforce, primary care providers and public health practitioners, blah, 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 blah.
Be that difficult to do.
Expand funding, loan repayment, adequate reimbursement, grants for training, infrastructure support.
Well, but isn't part of the problem if you don't have the programs? I mean, nursing educator, Marilyn has been a nurse educator, so maybe she would know, but isn't the problem that there aren't enough qualified instructors and programs for nursing? It's not that there aren't enough people to go into it.
keep raising the level.